Medicare annual enrollment underway right now, and the holidays are a really good time for seniors to sit down with family and talk about various options. Joining me today, Dr. Anastasia Karamanides and Chris Carruthers to talk about this annual enrollment, which has a short window life, right? December 7th is the last day to get this done, Doctor.
That's exactly right. And with the holidays coming up and getting together with families, it's a great time for seniors to sit down with their family members, their adult children, and discuss their medical coverage so that everyone in the family is aware of how they're covered, what wants to happen, what they want to happen if they were to get sick, and make sure that they're getting the most out of the benefits that are available for them so that they can stay healthy and active.
Yeah, and Chris, it's not just about current needs, it's also about the future as well, and that's something that the family should talk about.
Right. Absolutely. There's so much to consider, and obviously with the plan changes, we have a lot this year. It's important to look up to make sure your doctors are still covered, your medications are covered, all those things so the family knows how to support their family members.
The question everybody has is what doctors are in network, which doctors are not, and then those that are in network, how long does it take to get an appointment?
That's exactly right. So the very basic question that you need to ask when you're thinking about what coverage you need is, who do I need to see in this next coming year? Which is my primary care provider I want to stay with or I want to change to? And how easy is it to get in with them?
Right.
You know, if I'm sick tomorrow and I need to be seen, am I going to be directed to an emergency room or to an urgent care with a much larger out-of-pocket expense to me, and with disruption in your continuity of care, especially older adults? Some of them are on 10, 20, 15 medications. If you don't remember to bring them with you to the emergency room or to urgent care, they won't know what you're taking, and that's where medical errors happen, and it can be disastrous.
Yeah, and it can be so frustrating if you have something that needs to be taken care of right now, and you're told you can get an appointment 2 months from now. And that's why that research is important, Chris, right?
It is. It's important to do your research on your medications to make sure that you work with a broker to help you choose the right plan and make sure there's a continuity of care. But also, as we were talking earlier to Dr. K, that it's important to know that you can go to your doctor for a lot of other services. So sometimes if you think you've got a cold, you don't necessarily have to run to an urgent care. Maybe you can call your doctor's office to see if availability, because they have all your charts, they have all your medications on file. That makes things a lot easier for people to get the care they need.
And you also want to be aware going in what type of costs are associated with various prescriptions.
Yes.
Absolutely. And that's something that I, as your primary care provider, will be a lot more conscientious of than someone in urgent care or, who's giving you the drug of the day. And honestly, if we know our patients well enough, we oftentimes don't even need to see them. If I know a patient I've been taking care of, I know what medication she's taking, I know how reliable she is, and she calls me and says, I think I have a bladder infection. Yeah. She doesn't have to take time away from the holidays or put off flights. I mean, I've had patients do all sorts of things to get in to see their doctor for an antibiotic that could have been prescribed over the phone if you knew the patient well enough.
Yeah, that research is so important. Dr. K and Chris, thank you so much for joining us here today. P3 Medical Group's new Pecos Clinic opened today on Pecos, just off of the 215 in Henderson. If you want more information about all this information that we're talking about, because obviously there's so many questions associated with this, 702-888-3148 is the phone number to call, or you can visit their website at p3mg.org.